long would you say after someone gets an injection it's going to last for?
Of course, it depends on the type of injection and the health of the person, the health of the joint, for example, if it's a joint injection. But we hope that these last many months, if not longer, during the regenerative process. We will customize each patient's care and evaluate them, hoping that one injection does the trick. But there are some cases with significantly degenerated joints and other problems where multiple injections may be necessary.
Can you just break down again, exosomes versus stem cell? I don't know if I got that.
Sure. Stem cells were discovered, in the last couple of decades and applied in medical settings because these stem cells can develop into any type of cell. They can help regenerate. They can help build collagen. They can help cellular health and general health. They've been used mostly in the orthopedic setting, however, for improving joint health, for joint pain and joint dysfunction like knees and hips and that kind of thing. They got figured out not too long ago that stem cells that are delivered actually turn on the other stem cells. They activate your own cells and stem cells, and they do that through a little signaling process, a little messaging process, through small particles that one cell gives off to another to communicate, called exosomes. These are also called extracellular vesicles. And certain size exosomes from stem cells activate other stem cells in your body and other cells to be more youthful, to turn on the machinery of that cell and the metabolism of that cell to behave like it was many years earlier. That cellular youth process is turned on by exosomes. Therefore, exosomes are the more direct signaling entity to turn on your own stem cells without having to receive stem cells.
If I've had cancer, or I do have cancer now, is it safe for me to have a stem cell injection?
We don't feel that it is safe to use exosomes or stem cell treatments in patients with cancer. The only exception, of course, is a bone marrow transplant that we're not presently doing here in this practice. At this time, that is not allowed. Now, in the future, there will be designer exosomes to treat cancer. We just don't have those at this time, and we don't want to put anyone at risk.
Guy talked a little bit about the infusion, the IV infusion. Can you just tell me a little bit about what that does and how that works?
So we're excited to say the IV infusion goes everywhere in your body. The exosomes go to your glands, they go to your liver, they go to your joints, they go everywhere. Now the whole body doesn't get or any individual part doesn't get as much as if we delivered them directly through an injection to the knee, for example. But this helps with aches and pains, any inflammatory issues in joints, general health. It helps reduce blood pressure. It helps reduce blood sugar management in a diabetic patient. It gives energy and it gives vitality. This is an attempt at anti-aging treatment because it sets back your cellular metabolism to a more youthful state.